أحب أول شيء أبارك لكم وأتشرف أني أكون معكم اليوم. أبارك لكم بعد عناء السنين هذه الطويلة اللي قضيتوها في الكلية هذه، أنكم خلاص على وشك التخرج، وهذا إنجاز الصراحة، يعني أهنيكم عليه. لكن هذه بداية المشوار، زين، وكلكم عارفين الشيء هذا. طبعا هو مطلب، زين، وأنتم وصلتم يعني الحمد لله رب العالمين. هانت كلها آخر سايكل تقريبا، وإن شاء الله بإذن الله بتبدأوا. طبعا الشيء الجميل عندنا في الانترنشيب انه اذا في اي تاخر او تعثر من لاحد الزملاء، انه في انتريز، في 3 انتريز، يعني اللي يتاخر او شيء لاي سبب من الاسباب we can still accommodate him. زين، فعندنا every 3 months او sorry every 4 months we have one intern entry. فكل املي باذن الله سبحانه وتعالى انكم تبداوا معنا في بدايه جولاي باذن الله سبحانه وتعالى، وتكون الامور ميسره. طبعا I'm going to talk today about the framework for medical internship competencies. Okay? So what I mean by this, what should the intern or the intern do to be a competent? Okay? What are the things that the intern should do? What is the outline for this framework, okay, to be a competent intern? Anybody has anything in his mind about it? What do you think you have to do? What is the framework for you during this year to be a competent intern? Muad?
Show
Commitment. We need it in bigger word, okay? Honest. So behaviors, all in attitude, all in one word. We can say punctuality, all the same, okay? All in one word, we call it professionalism, okay? Professionalism. What are the other things other than professionalism? Yes, you are professional. Yes, knowledge. You have to have knowledge, which the one you acquired during your medical school. And then the skills, okay? These are the things that will make you competent interns. And I think at your level, the most important one is the professionalism, okay? This is, if I have intern or junior resident rotating with me, this is the first things I will look for. I need him to be there, punctual, on time. I will not evaluate him based on the knowledge that he has. I know the knowledge. If he has good attitude, he is keen to learn, good behavior, I know the knowledge will come with time. Okay? So always focus on professionalism. So we'll move and we'll talk about them one by one. In clinical management, which involved your clinical management will be based on your knowledge and your skills, okay? And then communication, and it's part of the professionalism, but we'll talk about it in individually, and professionalism, okay? So starting with clinical management. So it's part of your knowledge to have, you have to know and master the most common and important condition in each specialty, okay? And you have to know how to get a proper history, be able to detect the clinical signs, and you will be able, once you have the history and clinical signs, to put them together and come up with differential diagnosis, okay? Once you come up with differential diagnosis, you will be able to tell, based on the knowledge that you have, you will know that this is the level of your responsibility in treating this case. Now you will know. You get to the limit, you put all things together, and you will talk to your seniors, okay, who's with you in the team. It's a teamwork, okay? It's a teamwork. So you will put them together, so you will, then you will take this information that you acquired from the patient and from your study and discuss it with your seniors to come up with a treatment plan. And this will ensure that you are conducting a safe patient care, okay? By knowing your level of responsibility. So you are not making or trying to do things over than your limit, and that will subject or jeopardize the patient care. Okay? So going through this quickly, like clinical management. So once you acquire relevant clinical knowledge, and this is what you have done over the last 5 years in this college, 5 or 6, 5 years in this college, or 6 years, sorry. Okay? And now to be able, so this, we talk about it, but I need you to know this one. Do we have a laser here? لحظة. شكرا. So this applies soup approach. So you talk the history, you construct your differential based on the history and physical, and you plan your investigation and management with your seniors, okay? And you prescribe the medication safely. In the start, it's basically you are not the one prescribing, you are following the order of your seniors till you know their system, their protocol of treatment, okay? And you have to keep accurate and relevant medical record. Apply SOUP approach. SOUP approach is the approach that we use since we've started this practice as intern. I've learned this SOUP in intern, how to write a proper daily patient progress note. Okay, so starting with subjective, is the patient doing well or ill? Is the pain is controlled? Okay, about their vital signs and objectives. And then you do your assessment for the patient once you get your subjective and objective, and you write this daily plan. And once you do it in this way, the team you are working with, they will know that you understand and you are doing your work in systematic way, okay? And you have to have the skills of treating a patient who come in acute or emergency conditions. Okay, now we've done the clinical management. We know it's based on your, in your knowledge and knowing your level of responsibility, okay? Now, the professionalism, which, as you said, Guy, before, it's depend on the attitude, continuation of education, which is very important for you for the whole work life. You have to keep going, okay? Continuation of education. And understand the doctor's rule, or I call it chain of command, okay? So demonstrate appropriate time management and decision making. At this time, you are really involved in time management. Your decision making usually when to call your seniors. It's really hard. Yes, you will decide about lots of acute or emergency cases that you are going to deal with during your internship, but the decision, it's something very critical and very important, and it's difficult even for the consultant level to decide sometimes about these cases. So, and this, it needs a long learning curve to build up your decision making. And the decision making is, it's the key to differentiate between a two physician or two surgeons who's really good, can make his decision fast and communicate and take the decision fast and like in critical situations, and take care of the patient from the start. And it's, you know, for decision making for difficult cases, still you want to maintain the patient safety. And to maintain the patient safety in these cases that require decision making and tough cases, you may consult, even if you are senior, you need to consult your colleague, okay? So for the interns, you can consult who's with you, taking it from the junior level going up to the seniors for decision making, okay? What you will do. And this is what I'm thinking of. Like for you, if you make a blog, like everybody, maybe if you are doing a pediatric rotation, you will see cases that maybe your colleague, rare cases, will not see it. You were lucky enough to see it based on the time and location that you were in and see this case. And it's very good if you make this blog and share these nice interested cases that you see during your internship with your colleague, okay? You will come up by end of this year more than like thousands of cases. You can divide it into specialties and you share it. This is how you are going to enhance your exposure during training, because you will be spread over the Riyadh or Kingdom Hospital, okay? So you will be able to see cases. Sometimes your colleague or 90% of your colleague won't see it, okay? So understand the principle of clinical governance. What I mean by clinical governance, it's still the same, the chain of command. You have to know what is every one of the team member with you, what is his limit and what is his main duty. Ensure and promote patient safety, and this is, as we said, we'll go over it quickly. Practice patient-centered care. Make patient safety priority to clinical practice, okay? So all it's about patient safety here. Patient safety. Understand the importance of good teamwork for the patient safety. So you have to practice it and you have to maintain it, okay? The patient safety, you have to practice it and maintain it, and understand the principle of quality and safety improvement. Understand the need of the patient who have been subjected to medical harm or errors. Sorry. So again, infection control. In cases of the emergency, you are involved in the case, multiple trauma patient. You have to ensure the infection control. Okay, infection control started by yourself. Washing your hand, wearing a gloves, putting gown, goggles, cover your eyes, okay? Face mask, starting with this. And when you deal with a sick patient or patient under there's sign on the door of infection control, you have to practice safety precaution or infection control to conduct a safety patient practice, okay? So understand the principle related to ethical and legal issue, medical ethical principle, confidentiality. This is the most important one for you, is confidentiality. And most of the time, especially if you are doing surgical rotations, they will ask you to do the consent. Make sure you don't do a lousy consent. Make sure it's informed consent, okay? Talk to the patient very well. Understand, before the resident throw this task to you or over your shoulder, ask him, what is this procedure if you don't know it? Okay? What is the expected complication? So you are going to learn two things. You will learn about this procedure and you will learn how you are going to discuss it with the patient, to discuss this with the patient or patient family, okay? So you will not expect to have the patient sign for you blindly, okay? So make sure when you have this task to ask before you go to the patient, okay? Otherwise the patient will throw this paper in your face, okay? And you don't want to be in this situation, okay? Legal framework for medical practice, and this it's different actually from center to center, but you've learned it with time by making a good behavior, good relation with the patients and with your colleague. You will be able to know the legal framework since you are sticking or listening to your seniors, okay? Maintain education portfolio to respect personal professional development. Okay, last one. I know this is quite boring and most of these maybe you know it already, huh? But it's very important to know it. It's very, very critical. Communication skills with the patients, how you communicate with the patient. You communicate with the patient to discuss with him and tell him about their medical conditions with respect and dignity, okay? You may talk to the patient or communicate with the patient. You have to know how to break even the bad news. If patient have a critical conditions, And this you will learn it with time. So you have to learn, even during internship, how you communicate with the patient in these conditions, how you break bad news, okay? And with your colleague, the communication with your colleague is very critical. Once you know their everybody duty, once you know their duty, what is their limitation, so you will know how you communicate with them. And every time, try to follow the chain of command again, okay? So you, as an intern, call your resident. Don't jump straight ahead to the specialist or consultant, okay? And recognize and manage conflict. And most of the conflict we have in the medical field is because of lack or miscommunication. So once you know everybody, you as intern, as the most junior one in this teamwork, once you know the duty of every member of the team, you will be able to avoid conflict in the practice. So communication skills, as we said, maintain a professional patient and patient-doctor relation, different circumstances, like in consultations, and breaking bad news and complaints. And be effective teamwork player. You are the most junior, everybody will expect from you to know everything about the patients, about their patient in the team, about everything, about the clinic, how many patients they have in the clinic even, about everything. So be effective teamwork player within the clinical team by communicating professionally with the colleague with respect to the chain of command, okay? And teamwork, and interface with different specialties and with other professionals, and this is usually during the consultations. And this is the chain of commands. Maybe this is not well clear, starting with medical interns, resident, medical trainer, registrars, who's usually the specialist, consultant, then the head of the departments, then the chief executive director of the medical center you are working on. So this is the way, and usually you will not get to this easy, huh? But usually your communication within this is the team that you are working with in daily practice. And I know in some hospital maybe you won't see the consultant quite often. Going through the internship objective, and by the way, everything I'm mentioning here, it's available in the manual. I don't know if you received the manual. Everybody should receive a copy of the internship manual, okay? So going quickly over the objective, so you have to enhance your knowledge that you acquired during your study, develop a technical and improve your skills to conduct a better medical practice, take increasing responsibility of the patient care. So this is very important for you as an intern now. Starting, you will feel that maybe you don't know your responsibility, but this is the time that you will develop and increase your increase your responsibility, okay? To be acting like by the end of your internship almost like a resident, okay? And honestly speaking, when you start your internship, you are just fresh. You've done your medical school. You have the knowledge much better than the resident. And you will be able to discuss the cases maybe in advance better than the junior resident. Because you've just finished, you are fresh, you have the knowledge in your mind. So, but keep the knowledge at the side, how you develop your responsibility. It's very important, how you increase it, okay? And this comes with time and practice and exposure. You have to, the more exposure you have with the patients and involved in the clinical management, the more, the faster you will build up your responsibility and competencies. Develop professional judgment and appropriate care of the patient. Use diagnostic and consultant service. Work within ethical and legal. This is again, we are repeating, contribute a multidisciplinary healthcare team. Explore personal career goal and expectation. Encounter and develop strategies to deal with the professional and personal pressure associated with being a doctor. And this is very important. So the pressure for you with being a doctor, not only from your families, friends, social life away, even maybe from the team, maybe you will, from the people that you are working with, maybe from the resident, maybe you will have nasty resident you work with or consultant. And I'll give you something to read it, like in coming slide about this. Okay, after talking about the framework, so we almost done this talk. Okay, now the question is, who is the intern? What the people think about the intern, from the patient and from the doctors, your colleague. Who's the intern? What do you think the patient looking to the interns? Huh? Nothing. Huh? Trainers. Okay, this is the educated people. They know that you are trainers. Okay, but what about the other people? If you come like you are an intern, what do they think about you? What you are?
Where is your specialty?
Huh? Where is your consultant? Yes. Where is your consultant? So that's mean you are nothing. So they think that you are the devil wearing white coats. Okay? This is the patient thinking about you. And I'm outlined this book actually, The Devil Wearing a Scrub, and it's been this published in, I think, maybe end of 2013 or early 2013 by Friedman. And this book, I've read it recently since I hold the medical internship unit. Like I'm in this unit for almost a year now. And I've read this book. It's telling the story of a nice, of a good intern, her name Janet, who has been trained badly or been tortured badly by awful resident. And that resident called Alyssa. And she gave her hard time. She tortured her. And she went under so many circumstances, okay? And to drive her away from being a human dealing with the patient, and they have a sick old woman dealing with her, okay? And I will leave this book for you. I will advise you to read it, okay? I cannot go over the whole story here, but I will leave it for you to read it. It's quick and easy to read. It won't take maybe more than 2 days for you, but there's lots of story and morals behind it. Okay? So other people will think that the interns are maybe from the doctor. He's full. He doesn't, like even simple condition like tonsillitis, the patient opening his mouth widely and he's still thinking. He's not able to diagnose tonsillitis. So this is the other thinking of the people about the interns. But ourselves, we think the interns are a gentle medical doctor who has been studying hard and under tough condition and stress over the last 6 years in this medical college. And at the end, they should receive a respect. Okay? I think they are a hero. Okay? So always think very well about yourself. Be confident from inside, even if you feel that the patient ignoring you, even if you feel that your attending, like your consultant, at the end of the rotation doesn't know who you are. And you will have this. You will think that the resident dealing with you, either abusing you, ignoring you, not listening to your questions, because you are with him face to face in daily practice. You are sticking to him. Or the consultant even doesn't know who you are, and you come at the end asking for his evaluation. So feel very good about yourself, feel proud about yourself, okay, and confident, and I'm sure all of you will succeed in your internship, and you will learn a lot. Thank you so much. Wishing you a wonderful internship.
Thank you so much for Mujdi. Now the time is open for questions. We will have 10 minutes for the male side, 10 minutes for female side.
Like, I'd like to ask a question before we start. Did anybody review the manual? Because if you read the manual, I'm sure you will find lots of answers inside it. And I hope your question not involved in the manual. This how you are going to help me to improve and add to this manual, okay?
دكتور بس في سؤال اللي هو الايفالويشن. طيب في
Yes,
الايفالويشن
yeah, sure.
الايفالويشن المطلوب منه هو ورقتين، وفي بعض البروسيجرز تكون اصلا بعض الاحيان بعض المستشفيات ما تسويها، فصعبت على اخويانا اللي هم في السنه اللي فوقنا، فكيف ان احنا بتصير معنا؟
Yes, it's totally true. Even if, like, it's really difficult, like having evaluation and portfolio that divided into 2 or 3 sessions. We are going to have a meeting this coming Tuesday as internship committee. It's not one-man decision. If it's my decision alone, I will say only one evaluation form like the same one resident have, okay? Our evaluation is tough for the consultant, for you guys. It's not an easy. It's very good. It will, if we can ensure like it's your internship happening in university hospital, our hospital, under our control, it will be very good for you, making sure that every one of you will have a good exposure. He will have like he will have a chance to do a procedure, all of this. But it's really hard to apply it. If you are going to do a rotation in some of the hospital, they won't accept to do it. I know. So in this coming meeting, we will discuss it, this evaluation form, if we are going to abandon the portfolio or we will keep it. So I cannot answer this question now, but totally agree with you. I know you are keen, you want it to be done, but usually you are facing difficulty from your tutors or your mentors you are working with.
Okay, another question from the male side. Okay, now we will receive a question from the female side.
معقولة ما عندكم سؤال يا شباب؟
سألنا كثير أول.
ها خلاص سألتم ها؟ اللي قبلكم ها؟ عارفين الإجازات وعارفين كل شيء يعني ها؟ أوكي. جبت الإجازات طلعت ليالي. قريت الكتاب؟ عارف كم عندك يوم؟
لا دكتور بشرح إجازة.
خلاص.
السريع دكتور يعني هل هي مثلا
اقروا الكتاب فيها عدة نقاط، اقروها واضحة جدا مفصلة، شرحناها بالتفصيل في الكتاب. هذا بس شوفوا الشيء اللي حاب احرص عليكم اركز عليه، انه الشباب اللي قبلكم ما اهتموا فيه وبيأثر عليهم لما نيجي في نهاية الشهر نحصر الايفالويشن ونحصر الامور هذه كلها، انه you should provide us with the vacation form. We have a special vacation request, so you have to make sure that you fill it up and send it to us, send it to Benz, our secretary, before you go. Or even after, but get it approved by the department you are working with. But we need it as a record, so we traced your vacation. Because if you take like 2 months, I won't know. Honestly, I will not know. But by having this, I will know that this time you take either you take over or you take less or you take yours. What you desire based on rule and policies. I will know from these forms. So make sure you fill it up, okay? To avoid any delay later on when we issue your certificate.
When we start our rotation, we should communicate with the department, sending fax, taking paper to security events.
You are already started, you mean?
Yes.
Communicating with whom? With us?
With you, yes. We
Yeah.
starting as this and we finish this.
No. Now, before you start your internship, I will be able to tell I will be able to trace where you are, okay? I don't need from you to inform me that you are in this hospital. I know based on the acceptance that we have received later that you will be like July, August in this hospital, January, February you will be in different hospital, different rotation. I will know, we will trace you. Don't worry, you won't be lost.
Some hospital, like King Salman Hospital, if you want to take rotation, and then they force you to take Arabic month, like Ramadan, Shawwal, like this. If you make
What
it
do-
like July or August, they won't accept you.
No, no, we are going by geographical. We cannot go by hijrah. No, we can't. They should understand this. Like, I have to talk to them. I know the people there. We will talk to them. I know recently we faced some difficulty with them. But even they ask, we send the letter to them, they ask for this letter to be in Arabic. I don't know. We communicate with the whole hospital in English, and they should accept it. نعم. انتم بالنسبه للشميسي هل اعطيتم بنز الاسماء ممتاز، هذه بنتابعها والفولوت طبعا. الشيء الجديد اللي هو عندنا كمان مستشفى الامير محمد بن عبد العزيز شرق الرياض، بس جراحه يا شباب، بس جراحه. ارسلوا الاسماء البنز والتواريخ عشان نرسلها مره واحده وبنتابع احنا معهم. الحرس بنرسل لهم ايميل ان شاء الله الاسبوع هذا ونشوف باذن الله ايش يطلع معنا. العسكري واجهنا بعض الصعوبات، ارسلنا لهم ايميل فردوا علينا بكم خطاب قبول، ولا زلنا نحرص ان نحصل على اكثر عدد ممكن.
دكتور صباح الخير.
صباح النور.
الله يخليك دكتور.
اجازات ما في.
لا لا. بالنسبه للاكسبتد للكينج سعود ميديكال سيتي، يعني they refuse some of us. فاحنا الحين قاعدين مع فلان قدمنا. اشكاليه ان تجميع الاسماء هذه بعض الطلاب كان لهم مسبقيه في التقديم، راحت بسبب تجميع الاسماء هذه. الان في فالان الاسماء الان اللي مرسله ايضا لقوى الامن، اخاف ان بعض الطلاب ايضا يعني they will refuse يعني some of us يعني to sure. فوش العمل يعني لو مثلا انا واحد من الطلاب اللي رفضوا، وش خاصه يعني الان اغلب المستشفيات
على اي قسم تتكلم؟
سم؟
اي قسم؟
يعني مثلا عندي الفاميلي ميديسن والبديان، يعني مثلا كينج سعود الان refuses.
Okay, family medicine it's a problem now, but the pediatric it shouldn't be يعني. Usually they accept حتى قوى الأمن. فاحنا نحاول نطرق كذا باب ونشوف ايش نقدر نطلع فيه بالأخير. بس what I've noticed like over last month we are progressing يعني. أنا حاطها كذا I'm making big table with the name of the interns, the rotations, and I've started filling the gaps like. We are progressing more than like 60% now. It's being filled up, so we are doing good. So inshallah we.
طيب دكتور كنا بسأل عن بعض المستشفيات زي مثلا مدينة المملكة الطبية، يقول لك ما تقدم على الانترنشيب الا قبل الروتيشن اللي يعني تبغاه ب4 شهور. يعني مثلا اذا تبغى روتيشن في شهر 11 12 لازم تقدم شهر 6 7.
We have to stick to their rules. هذا الأكاديميك أفير they told you that?
Yeah.
Okay. We have to stick to their rule.
دكتور.
Thank you.
العفو.
السلام عليكم.
I cannot hear. There's a questions? So, like when you have a difficulty with King Fahd Medical City, like telling you after 4 months, try to put your name like they refuse, totally. Yeah. This is, anybody being accepted at King Fahd Medical City? Anybody has any acceptance from them for July, August? No. الحرس still not open yet. King Fahd still ها؟ قالوا ابريل ولا they open already؟ ايوه. Only.
السلام عليكم.
And nobody planning to apply for in July, August with them? No? No? Okay. Yes, go ahead.
دكتور.
تفضلوا الفيميلز اذا عندكم سؤال.
السلام عليكم.
وعليكم السلام.
شكرا دكتور على البرزنتيشن أول شيء.
بس اذا ممكن ترفعون صوتكم.
صوتك ما هو واضح.
دكتور هذا أعرف. طيب السؤال دكتور في بعض المستشفيات يطلبون GPA. فاحنا أغلب يعني آخذ كورس أخذناه مو ريجسترد وهذا وقت إنه we apply.
Okay.
هل ينفتح السيستم تدخل؟
Okay. I understand. Which hospital asked for GPA?
ملك فهد والحرس.
مدينة الملك فهد والحرس الوطني.
الحرس الوطني
والتخصصي.
وملك الملك فهد.
What we can do, okay, we will help you with this. This is easy, okay? We can get your GPA, like preliminary GPA, and put it within your letter, okay? And you can submit it to them. We've done it before. We've done it to the previous group. You can ask them. We attached your GPA together along with the subject line.
أقصد دكتور the latest GPA اللي يعني في آخر الماركس حقت the last rotation we had اللي هو one week ago.
ما I cannot. فهمت وش؟
احنا دكتور سنة خامسة
I know. It's preliminary. It's not your final GPA.
قصدي the updated one. يعني مو أفضل دكتور لأنه حرام يعني ترى.
I don't know. This I will be able to gain it from the academic affair. I can get it from Dr. Khalid al-Barikit. We can ask for it, okay? Last year when I started with them, or this current interns, they started when I hold the unit. I hold it in September, they were already started their internship. So, and at that time I was having the GPA for all. For you guys, I think I will be able to get it, but it's not your final GPA, okay? It's without your maybe last semester, okay? Or current semester.
دكتور.
Yes, go ahead.
Doctor, we had a problem. Some of my colleagues went to Prince Sultan Military.
I know about that.
Yes.
I already contacted Gumasha for that, and I think we will receive some of the acceptance.
No, but doctor, now most of all the hospitals are accepting our college. بس يعني ما شاء الله المale batch is really huge, but there's no space for us. Can you kindly just tell the hospitals to give space for the female because we're only 24.
Okay.
To make it more fair.
Okay. We will try to push hard. I know most of you are interested to be in military hospital. We will try to get more, and we might have a meeting with them and see how things goes. It's need time. Like give me 1 to 2 weeks maximum, inshallah. I'm working on it. By the way, like their academic affair, I've contacted them by phone. They don't answer even their email. I sent email. The same day I sent the email, okay?
Yeah, they never replied.
They didn't reply to my email, but we received some acceptance. So I received about 4 or 5 acceptance. I didn't check the names. It's in the office.
طيب دكتور تنصح بمستشفى أمير محمد؟
بس إذا ممكن تقربين المايك، قربي المايك على.
Sorry. What she asked?
بس قربي المايك لو سمحتي.
تنصح بمستشفى أمير محمد؟
مستشفى الأمير محمد بن عبد العزيز؟
Yes.
قسم الجراحة فقط. الجراحة والتخصصات التابعة لها.
يعني كويسة؟
ممتاز. They have good exposure. We have a good number of the staff from this college working there now as a part-timers.
يعني they had interns before?
No, not from our college.
لا أقصد from other colleges.
I don't think so.
Okay.
No, first time. But they have good staff. I'm sure. I asked my colleague who work there. They have good exposure and good staff.
السلام عليكم دكتور. أول شيء شكرا على البرزنتيشن. ثاني شيء في مستشفيات كثير كنا نتواصل معها، فكان ردهم إنه إحنا تواصلنا مع جامعتكم لا تجونا، وأرسلنا المتطلبات حقتنا للجامعة فخذوها من الجامعة.
أي
أغلب المستشفيات ما نعرف إيش متطلباتها، فحابين لو بن يرسل لنا كل مستشفى إيش تبغى مننا بالضبط.
كل مستشفى إيش يحتاج منكم بالضبط؟
إيه، لأنه في مستشفيات تحتاج CV، في مستشفيات ما تحتاج، في مستشفيات تحتاج
يحتاج CV؟ No. تخصص okay. This is something you can provide the hospital. Along with your letter, you can provide them with your CV. We don't know. You know, every time they are coming up with something else, okay? And we don't have a strong agreement with the hospital. Like King Saud Medical City, we have the agreement with them that's been made from last year, and they are not stick. They are not committed with us. Sometimes till last moment, they will tell, okay. And those, some of the interns, they have acceptance. They say, okay, sorry, we cannot accommodate them. We have agreement with them. They are not accepting family medicine now. They are only accepting, I think, 5 or 10 interns for the whole year. So we are facing difficulty. This is why we are looking now for other hospitals.
دكتور زي مستشفى الحرس يعني we tried to contact them many times. كل مرة يقولون please لا تجون خلاص إحنا.
I don't know if you can hear very well.
ثاني شيء في مستشفيات طالبة مننا.
بعد إذنك المايك قربي لو سمحت.
في مستشفيات طالبة مننا تطعيمات، فحابين لو نقدر كلنا كمجموعة نعمل هذه التطعيمات في الخدمات أو مع الجامعة، لأنه صعب إني أروح أسوي تطعيم لكل مستشفى.
إيش السؤال؟ So your vaccination record based on most of the hospital will be valid for 6 months. Okay? Then you have to update it. You are updating it, doesn't mean that you will receive injection every time. Once you go to the family physician and he saw your vaccination card, he will know that you are immune. He will just change the date and update it. He will stamp it and he will give you a new card. Okay? This doesn't mean that you have to update it every time. Wa alaikum salam wa rahmatullah. Dr. Khalid. But the things that you might need to do like every 6 months, they ask for hip screen, okay? Like King Saud Medical City and other hospitals, even King Faisal, they ask you to make sure that you have the hip screening, okay?
دكتور regarding مستشفى الحرس كل مرة نتواصل معهم يقولون لا تتواصلوا معنا ارجعوا احنا كلمنا جامعتكم. فايش طريقة التواصل مع الحرس يعني؟
الحرس I'm going to email them this week. They are not open yet. They will open by April. And and this hospital, they don't accept seeing one by one interns. So I will get the whole request from you based on your wishes. We'll put it in one request and send it as one, okay? And usually they are very good in communicating by email and sending fax too of the acceptance letter. Like King Saud, like the university now. We receive lots of fax from them with acceptance letters.
دكتور لو سمحت بالنسبة للفاميلي ميديسن بما انه في صعوبة في اغلب المستشفيات للي مو انترستد وحاب يقدم في المراكز الصحية، يعني احس اعطونا المجال عشان ما نضيع فرص الناس اللي really interested في البيج hospitals.
This is very good idea actually, okay? Now we are very limited, like Dr. Khalid, you are here, maybe you can help us with your colleague. Like we are facing difficulty with family medicine, like King Saud Medical City, which we have agreement with. They said we will accept only for the whole year, 5 to 10, only. They are very limited, and 2 per rotation. And military hospital, we have difficulty to accepting family medicine. So their point now, we will leave the hospital with this fixed number for the people who are interested really to be involved or to be a family physician later on, okay? And trying to get those who are not interested to practice in the smaller clinic or primary healthcare clinic. I don't think that there will be a good exposure there. What do you think, Dr. Khalid?
Assalamu alaikum. I think we have a problem in family medicine rotation. If we send a student to the primary health care center, and honestly, it is a waste of time.
Yes.
But again, it is a way of exposure, how to see the things differently. If there is mixed exposure, yes, we agree that we have to go this. But as a solo, a rotation in primary care centers, we need to look at this one carefully. What we are going to do now with the big centers like military hospital, National Guard, that we shouldn't devote only the student allocation to the training center, because usually there is a good practice. So even in a training center we can send. But the problem that they do have, they have residents, and the resident now, during their residency program, they have to spend 3 months every year in family medicine center. And usually the first 2 years they are settled. In Riyadh Military Hospital, they have 72 residents. If we divide one per consultation, then plus the interns, plus the students, it's going to be full really room. We try to manipulate that one, but we have to do the best that we can.
Okay. Sure. Do you think, Dr. Khalid, is there any alternative rotation that can provide them with enough knowledge?
Well, I think that the ambulatory care can be provided by ER.
Okay.
But we can combine them. And the other thing, that not all the primary healthcare center of the Ministry of Health are equal at the same level. We have discrepancies, and we will try to select the best out of these and give a chance for our interns to have their rotation there.
Sure.
Okay, last question from the main side.
السلام عليكم دكتور.
وعليكم السلام. تفضلي. آخر سؤال من الفيميل سايد.
Yes,
Okay.
okay.
تفضلي.
My main concern إنه المستشفيات اللي متعاقدة معاها الجامعة ما نلقى فيها قبول. يعني زي الشميسي صار فجأة كراودد، وإحنا كنا متوقعين إنه حنلاقي فيه قبول أكثر من أي مستشفى ثاني، بس اكتشفنا إنه الشميسي أول مستشفى ردنا.
Okay. I really, as I said before, they are not committed. This is why we are trying to open a different channel. This is what happened with the GS. Now the GS, like for last rotation, which is March and April, 3 of our interns been already accepted before, and all of a sudden 1 week, like it was a short notice, they been like they said, sorry, we cannot accommodate them. So we try to open now different or open like channels for each specialty. Like for general surgery, we are now targeting Prince Mohammed bin Abdulaziz, and it's very good for us because we had a couple of our staff who work there as a part-time. This will ensure that you will be like having a good exposure, okay, and good training there.
Okay, last question from the main side.
طيب دكتور، في سؤال بخصوص الخطابات. بنز يعطينا خطاب واحد لكل ديبارتمنت، فمثلا الميديسين قدمنا على الشميسي، ردوا لنا بعد شهرين مرفوض. فالجي اس الى الحين ما طلع القبول، اورثو نفس النظام. انا خوفي انه يكون بعد شهر يطلع
في المدينه؟
لا في مدينه مكسود شميسي. انا خوفي انه بعد شهر يطلع الخطاب المرفوض في الجي اس والاورثو. فاذا في
بس ليه يتاخروا شهرين؟
انا ما ادري. بنز رحت
لا انت مع ايان our coordinator there, usually they reply within 1 week.
على كلام ايان.
Otherwise they will keep your paper in the there. It's مثل المعامله في دائره حكوميه في الشماسي، you have to follow it. ولا غير كذا بتنام على المكتب الغامدي في الاكاديميك افير.
طيب على كلام ايان، رحت الاسبوع الماضي قال الاورثو ريفيوز والجي اس نفس الشيء. انا ما ادري عن ايه.
اورثو they will not refuse. I can't talk to them. I can't.
طيب دكتور الجي اس.
الجي اس
يعني اذا في مشكله ممكن يحط خطاب ثاني.
We have a problem, you will take it at Prince. مستشفى الامير محمد بن عبد العزيز خبرونا انه ممكن يقبلوا الى 15 انترن بالروتيشن.
بس مو نفس
which is good number.
الاكسبوجر حق الشميسي.
ما هو نفس الاكسبوجر بس I think it's not only the exposure, it's the quality too. And I think they have good quality.
في إمكان أن يكون مثلا GS ناخذ خطاب ثاني للمستشفى ثاني؟
ممكن.
أي نعم.
بالتوفيق يا شباب.
شكرا جزيلا دكتور مجدي. نود من الدكتور خالد انه يسوي تقرير بسيط